topic here, we have to understand health and wellness first before we jump to understanding emotions, emotional well-being, and mental health. So there are a few aspects, few dimensions of health and wellness. Number one, emotional health. It's all about maintaining good emotions, the positive emotions, keeping away from negative emotions, and it all depends on the environment you stay, or the lifestyle, on your habits, people around you, and of course the genetic makeup and the traditional layering of thought processes within the subconscious that leads to a good or a bad emotional health. Then we have mental health. Mental health is an extension of emotional health. How? That we'll see when we go to the stage-wise progression of a disease. As a drug has an action, the extension of that drug or a medication is called an adverse effect. So similarly, when we speak of emotional health, if it is if we call call it a side effect of emotional health, we can say is mental health because it is very difficult to control. Then we have social health, interacting with people, networking with people, communicating with people. These are all stress busters. Social health has to be normal. Then we have occupational health, your workspace atmosphere, how you interact with your seniors, how you interact with your juniors, how you interact with your colleagues. Do you have any work-life imbalances? Do you have any issues in your resilience while dealing with the while coping up with the stresses of work, pressure, maintaining a good family life, spending your time, spending time on yourself. So this is all about occupational health. Then we have financial health. Of course, with occupation comes finance, and with finance comes a lot of liability. So this is a part of health because finances and emotions are the major cause of mental health disorders at this time. All right. Then spiritual health is it's all about how you connect with yourself and how you connect with your higher self, how you carry yourself after doing that. You have to think of your karma, when you are completely into spiritual health, and then there has to be a balance. I'm not sure if this multidimensional approach has ever been fulfilled by anyone living in living in this world or on this planet. Physical health. It is very difficult to achieve all these 7 dimensions of health at one time. This multidimensional approach is therefore very important when it comes to emotional and mental health. So I would ask you here, which aspect of health do you think is the most important of all amongst these 7?